This is that.
So good evening. How's everybody tonight? Well, I am very proud to be here, and thanks to Dean, Joanne for inviting me. And it's just a real pleasure. And I think back to when they had a meeting in March at the Civic Center. It was the last meeting before the Civic Centers were closed down. March 14th, correct?
Yeah.
And I was a candidate at that time for District 4 Commissioner. Come a long way since then. And we've seen a lot of changes with regard to COVID-19, not only in our county, our state, but our country. A lot of things have changed. So tonight I'm going to hit on a few of those things. I'm going to discuss COVID-19 and Walker County. And I also want to talk about COVID-19 and President Trump, who tested positive. We'll talk a little bit about that and get some input from you guys. And we'll have just a brief question and answer session after that. So kind of like Dean was saying, I've been in primary care medicine. I start my 26th years here in June, started my 26th year. And I've also, I'm honored to sit on the Walker County Board of Health. I was nominated that position in 2019. And so I've really been able to get a lot of information about COVID, kind of get updated frequently from the Georgia Department of Public Health. Dr. Vocio, he is our really top-notch infectious disease physician in our district. I had a chance to talk with him Tuesday before this, so I've got some really updated numbers for you. I'll try not to bore you with some numbers. We've had supper. I don't want to put anybody to sleep. But just to kind of get started, in our country, currently, as of today, we have had 8,016,448 cases. Of those, 220,164 folks have died from COVID-19. In our state, currently, our cases as of today, 336,241. Of those, 7,492 have died. So, when we were at the transparency meeting on the 14th, we had one death. Okay, and that was on the 12th. So we had one death in our state. Fast forward, 7,492 today. Our county. If you kind of remember, Walker County kind of delayed quite a bit before we saw any cases. And then even early on, 3 cases, 9 cases, 12 cases. Didn't see a whole lot of cases for a while. We were thinking, oh wow, maybe we're going to really escape this and we're going to do well. So as of today, 1,718 cases in Walker County. 42 deaths. Of those cases, the median age is 43 years old. Okay? Of the deaths, of the 42 deaths, the median age, 75 years old. All right? Since October 1st, we've had 3 deaths. Okay? During that time span, 92 hospitalizations. So we have 42 deaths, 92 hospitalizations. What does that tell you? If you get hospitalized, you're sick. Large percentage of deaths in that number.
Does this count Georgia? Is it like Chattanooga, if you're hospitalized in Chattanooga and you live in Walker County?
It will reflect, it will reflect your resident Walker County. Yes, it sure will. And when you look at the numbers, there may be a lag of numbers simply because of reporting. If someone died in Tennessee, there may be a lag of a few days before that information gets to the state and then is put on the state information. Georgia, as of September 25th, the highest number of cases, fifth highest number of cases in the country. All right. So, in Walker County, our death to case ratio, 2.43%. And what does that mean? Well, when we look at the surrounding counties, Whitfield, Chattooga, Dade, Floyd, we're up a little higher than those guys. And I asked Dr. Vocio, why do you think? Well, probably because of the fact our median death age was 75. Okay, so that may be why that number is a little bit higher. All right. So, let's break down some other numbers. 34% of our cases in Walker County are folks who are greater than 55 years old. All right? 19% of the cases are in the 11 to 24-year-old range. And then 15% are between the 25 and 34-year-old range. The rest of the percentages would come in between those other numbers, but those are the key numbers. Of those, 46% are male and 52% are female. All right? So, how are we doing in Walker County? We're doing better now than we were in August. In August, 10% of the people tested positive. Now, to give you an idea of where that sits, nationally, it's about 5%. So we were a little higher. How were we in September? 4%. So we're doing better. We're doing better. And how do we do that? The same things that we've been told since March. Wash your hands. Wear a mask. Social distance. Somebody said this to me the other day, and gosh, it makes such good sense. Stay away from sick people. Okay? That makes a lot of sense. So we're doing better. We're doing better. I saw a number the other day. So we're in Walker County, we're at 4%. Idaho, 17%. So think about it like this. Walker County, we were delayed before we started seeing a lot of numbers. Same things out west. They're kind of delayed. Wyoming, Idaho, the Dakotas, now they're starting to really tick up. So, I'm hopeful that the numbers that we're seeing, this 4%, we're starting to turn the corner a little bit. That's very encouraging, I think, in our county. Let's talk about vaccinations, all right? Let me throw this in there. Get your seasonal flu shot. Very important. Very, very important. We could have a terrible flu season, and who wants to be the unlucky individual who tests positive for influenza A or B and COVID? So get that flu shot, okay? Get that flu shot. And I'm also going to throw a dig in for our local health department. Great folks, wonderful people. They have done a jam-up job during this pandemic, and they are just such fine folks. I'm honored to work with them, being on the Walker County Board of Health, and everyone I see that I get the opportunity, hey, if you get a chance, patronize the health department. Go get your flu shot. They do a wide array of wellness training as well, wellness teaching. So I would encourage you, go visit those folks. So with regard to a vaccination for COVID, is that something that's possible? Absolutely. Currently, there are 130 companies who are working on a vaccine. Now that's worldwide, okay? Now, according to Dr. Vocchio, we're close. He's thinking within the next few months, and that's very encouraging, very encouraging. Now, will everybody get the same vaccine? Probably not. It's probably going to be sort of like the seasonal flu. Children or adolescents will get a different formulation than geriatrics. Now, I don't know that to be a fact, but that kind of stands to reason, okay? But, I think it's very encouraging because of these 130 companies, they're working overtime and working hard to get that vaccine. They're working very hard, very diligently. So I think that's a wonderful thing. Testing in Walker County. So currently, our testing site is the Mount Zion Baptist Church, and I think that's over on Dunwoody. Is that where that's at? Okay. And so you can call Walker County Health Department, and they will tell you the times. They're going to tell you, to get there a little early because they do have to process the swabs and get them sent out. Turnaround has been really good. I actually had a swab done, and the turnaround time was less than 72 hours. So I was just thrilled with that because, when this started, we were looking at 10 days. So they really got very proficient in that. Looks really good. Again, I just want to,
Is the test still in the nose?
yes, ma'am. Yes, ma'am.
It
But,
looks like it's picking your brain.
well, they have sort of used a smaller swab now, so it's not quite going up to the frontal lobe. It's, it's way back in the back of the nares, but not quite as bad as it initially was. Yeah.
One of the art institute, my mom yesterday, you gotta put spit in.
Okay.
Mix it with the chemical that they've got.
Okay.
And that's one already that
Okay.
works on that thing like that.
Very nice, very nice. And, there are some independent offices who are doing, the antibody blood test and, how accurate are they? I think they're probably pretty accurate. I don't know exact numbers on it, but I think they're pretty accurate. And, when we do get tested for antibodies, we do know that those antibodies are probably short-lived. Those antibodies will probably not last us for a year. They probably won't even last us for 6 months. Not really sure at this point how long they will last. And, we're seeing where people may get COVID and they have to build some antibodies up, but they turn around and they may be reinfected. Is the case milder? Is it the same? It's hard to say. Not a lot of those cases out there, but I have seen some of those. With regard to what we're doing in the county, again, I think our numbers are much improved from that 10% down to 4%. But as a community, we just still have to, avoid gigantic crowds, wear masks, wash your hands, stay away from folks that are sick. When you go to the store, and this was pretty simplistic too, but it made a lot of sense. If you and your spouse are going in, or you and your children, rather than everybody go in, just one person go in. It certainly lessens your likelihood of transmission. So it's a pretty simple concept, but really it kind of makes a lot of sense. Take care of our friends and neighbors who are elderly. Our median death age in this county is 75. So that says to me, if you're 75 years old and you get this illness, it could be detrimental. So, if you could go to the store or do some folks for our seniors, do some things for our seniors, then do that. Keep them from getting out and getting exposed. Okay?
Do you have the virus that you don't have a fever? We're always testing for the fever.
Right. Unlikely. Now, early on, you may not have a fever in the early stages, but once you become symptomatic, you're going to have a fever, you're going to experience body aches, you're going to have a cough, usually a dry cough, and you're probably going to have a little bit of difficulty breathing. That can vary from mild difficulty breathing, in other words, walking from here to the front door, you may be a little short-winded, or you may be severely short of breath, even sick. So those symptoms can kind of vary, but yes, you're going to have a fever. Just kind of like the seasonal flu. Same thing. Fever, sore throat with that, dry cough, typical influenza type symptom. Yes, sir.
I want to help people remember this is a new problem. So my question is this going to be something like the flu? It's going to be with us from now on. It's going to mutate and change. It's the flu the common cold does, or we don't know. And are we going to deal with a herd of this where it's when they just where it was just go away?
So, excellent question. So, number one, is this the new normal? I think it is for a while. I think COVID is obviously here to stay. Are we going to see dips in COVID from a seasonal aspect? I think we will. But kind of getting back to the antibody question, if you get this illness, you're going to build some antibodies, but they're short-lived. So that's why the importance of the vaccine, very important. And just like the seasonal flu, viruses mutate. They do. Do they mutate greatly? It's hard to say. But when these vaccines are being made, that goes into their research. And it's not an absolute science. They kind of project how they think that it's going to be, just like the seasonal flu. And some years the efficacy is better than others. So we hope that, when a flu vaccine is formulated, that, hey, you know what, this thing is, going to hit, 75%, good coverage on it. That's what we're hoping. And I think with the COVID, that's the same thing that we're hoping. There's so many labs working on this, so many brilliant scientists that, I feel confident that it's going to come about, and I feel confident moving forward, they're going to be able to stay on top of the replication aspect.
Will people ever be able to stop wearing masks?
I sure hope so. And again, think back about the 1918 pandemic. It lasted after 1918 for, a couple of years, but then again dropped off. So I'm hopeful that we're going to see that with COVID. The longer we research this, the more we'll know about it. So,
What is the real effectiveness of the mask? If you hear some people say, and I'm talking about people who know what they're talking about.
sure.
If the mask are not really that effective.
All right. So we know that the gold standard mask is an N95. We know that without the filter. Now, what percentage of particulates does it pick up? I couldn't tell you. Okay. When we look at other masks beyond that, little lightweight surgical masks, cloth masks that are made out of different materials, Let me say this. I think any mask is better than no mask. Think about it from this standpoint. You go out and you mow your grass, okay? And you don't wear a mask. At the end of the day, you may have grass all over your face, but if you wear a mask and you take it off, you're going to have some grass on that mask more than likely. So you're picking up a certain amount of particulates. And we know that greater than 10 feet, really, from someone who is infected lessens your likelihood of getting it. Well, with that mask, you've got a barrier on it so that those respiratory droplets hopefully will not permeate that. So, I recommend the mask. I wear a mask if I go in a store or something like that. I just kind of think it's just a thing to do. It lessens my likelihood. Is it 100%? No, it's not. But I think it lessens my likelihood of possibly walking through a particular COVID. So, let's talk about President Trump. Okay? All right. So, just kind of a show of hands. Who was really concerned when we heard President Trump came down with COVID-19, tested positive? No. I was concerned. I think I became even a little more concerned when they indicated his oxygen saturation had dropped, and they put some oxygen on it. Then they decided to take him water in. I was concerned. I think as a healthcare provider, my concern came from, I can kind of see the cascade of events where this is going. His saturation has dropped, he's getting into some respiratory trouble. Oh God, I hope you don't wind up on that later. That's my first thought. So I said a prayer. Then, let's fast forward a little bit. How did that Walter A. Reed stay go? It went excellent. So he got in, was hospitalized, obviously had a bunch of diagnostic tests, chest x-ray, CT scan, lab works, etc. They started an antiviral medication on him, remdesivir, and they also started giving him some steroids, dexamethasone, and then somewhere in that mix, he received the experimental antibody cocktail, if you will, and moved forward to the following week, he's out of the hospital. Amazing. Now, 74-year-old man who's in relatively good health, he takes a statin, so he's not at a tremendous risk. He doesn't have frank heart disease, but he's at risk. He's 74. What's our number in Walker County? 75. So he's at risk. He's also at risk because he does take a statin. Okay? So that ticks up his risk a little bit higher. But look at how he prevailed during the hospital stay. So that treatment modality was most impressive to me. What that tells me is, yes, he's the President of the United States, and yes, he is going to receive the highest level of care, and he's going to receive whatever drugs that team determines he needs. But I think ultimately that may be the standard of care in managing COVID-19. Because, again, look back at Walker County. How many hospitalizations did we have? 92? How many deaths did we have? 42? What does that tell you? You go in the hospital,
You die.
there's a high likelihood. You know? Yeah. That's true. And so, we know you wind up on that ventilator, not a good prognostic indicator. So that was my concern with President Trump. Thank the Lord, he did well, and he prevailed. He's a tough guy, so I would expect nothing less. But, again, I think that was really something everyone should take note of. How well he did, how that treatment, how he responded to that treatment. And so, just most impressive. Yes, sir.
How much would that treatment cost, so an individual like me?
I wouldn't begin to put a price tag on it. When you look at just the hospital stay alone, okay? Just the hospital stay, nothing else. No labs or diagnostics or anything. Several $1,000s. Then you start tacking things on, put those diagnostics on there, put those medications on there. At the end of the day, you may be several $100,000s into it. And that's just an estimate. That's just an estimate.
What is the typical treatment modality here in Walker County?
Okay.
I mean, what drugs are we getting?
So, when the majority of cases are going to be mild cases, self-limited cases, people who can stay at home and recover from this. And that would be any type of a fever reducer. Tylenol is usually recommended because there are some studies which show that anti-inflammatories may actually kind of precipitate the virus a little bit. So usually something like a Tylenol, all right? Cough syrup, just your over-the-counter cough syrups, okay? Anything, obviously a lot of fluids, bed rest, those things to kind of get over the virus, just like you would the seasonal flu. Step that up a notch, okay? Someone who is starting to develop some breathing issues, not severe, but some. They may take some aerosol nebulizers like you've probably seen, some inhalers to give them some bronchial dilation, and again, kind of supportive care. Looking for any secondary infections that may pop up, such as pneumonias, okay? Then take that hospitalized patient, okay? The person who is having severe respiratory distress, the person who is developing those secondary infections like pneumonia, okay? Someone who may ultimately wind up in the intensive care unit. So that person is receiving very intense therapy, oxygen, okay? Oxygen. Either with a nasal cannula or a mask or a ventilator, all right? And they're also receiving aerosol bronchial dilations. They're probably going to be receiving the antiviral because it has been approved, so you're going to be getting the remdesivir, all right? You're probably going to be getting the dexamethasone too, which is a steroid. And dexamethasone has been around forever, okay? We give it for everything from poison oak to sores in your mouth. I mean, it's just, I told somebody the other day, I've probably prescribed a tanker truckload full of dexamethasone over 26 years. It's just a very common steroid. And it works excellent. And there again, dexamethasone was tried early on, I think probably in New York is where it was indicated that, hey, this works in people with severe respiratory disease. So that's kind of how that would cascade out as far as treatment modalities for people. The antibody cocktail, there are some studies going on right now. I think one of them is actually taking place in Chattanooga, where that is probably going to be moving forward. And hopefully that will be available to everyone. And take a little time to look at that antibody cocktail for COVID. Look at it, and it's really interesting how it works. Really interesting how it works. It slows down the viral replication and prevents the virus from building proteins and attaching to receptor sites where this stuff goes. When you inhale COVID droplets in the air, this is what's so kind of different from it about the regular flu. It attacks receptors that not only are in the lungs, but also receptors in the cardiovascular system, the renal system, kidney system. And so it attacks these receptors, and that's why oftentimes people who get COVID-19 and progress get kidney failure, heart failure, they develop blood clots. So it's just a cascade of events. If you get this disease and you progress to, severe disease. Joanne mentioned the seasonal flu and flu vaccines earlier to me. I've taken care of a lot of people with flu. And I was obviously concerned in older adults and children of getting secondary infections, pneumonias, in children, ear infections, strep infections, etc. But I didn't see a whole lot of folks who progressed to death. Some, not a lot, but with this, you kind of think, geez, so if this person goes to the hospital with severe disease, oh man, they might have gone to vet. Their likelihood of improving, not great. So we want to keep those folks, that's why treatment is so important, keep those folks from progressing to that.
Okay, if you think, let's say a member of your family starts getting a fever and you suspect, do you take that person to the doctor? Do you take them to the ER? Or, what should you do as a potential patient?
So if one of my family members developed a fever, a cough, and I was suspicious of COVID, I would, number one, say, okay, let's get a test. Let's get a test. And let's assess where this person is in the disease process. And you don't have to be medically trained to really determine how sick someone is. We all can look at someone and say, they're kind of sick, or wow, they're sick. So, fever, body aches, a little bit of a cough, I don't feel good. Or to someone can't breathe, spike in temps, getting dehydrated, people becoming delirious, confused, that is severe disease. In that situation, you're calling 911, you're getting an ambulance transport. Exactly. Yes, absolutely. And use President Trump as an example. Had started with a fever. I'm not feeling great. I'm not feeling. I think his words were, I don't have a lot of energy. I think that was his words. But what happened? They checked his oxygen saturation. It started to drop. They put some oxygen on him. Still was having issues. Walter A. Reed. That's the kind of cascade of events we're looking at.
Do we know how far his oxygen saturation was?
I don't. When you look at that, normal oxygen saturation anywhere usually 90, 95 up to about 100. If you put one on my finger right now, I may be 94. It's going to fluctuate. Where people start getting into trouble is when you start seeing numbers in the low 90s, 80s, 70s. See somebody with a stat in their 70s, they're struggling. That's a person who you're thinking ahead of time, this person may need intubation, airway management, and on a vent. And the old saying in healthcare goes, treat your patient, don't treat the lab, don't treat the monitors, don't treat that, treat your patient. But somebody with a stat in the 70s, if they're not getting into trouble right now, they're gonna be getting into trouble very soon. So you kind of need to look down the road on that person. Get ready, be prepared, know what you're gonna do.
No, my mother has that.
Yes.
And I know when she gets below 90.
Yeah. Yeah, exactly. I mean, so, and that person, just like we use President Trump again, okay? Let's just say his SAT dropped to, let's just say 90, okay? And they put some nasal oxygen on it. And they may have turned it up a little higher when that SAT didn't come up some. And a nasal cannula will carry about 6 liters of oxygen. Above that, it's just really, you're not getting more than that. So in that situation, hey, we're maxed out, his SAT's not coming up, time to the hospital. So, anything else?
Does having a pneumococcal pneumonia shot for us seniors, does that help?
Absolutely. Oh yeah. The number one community-acquired pneumonia is pneumococcal pneumonia. That's the number one community-acquired. And so getting that vaccination, I think it's an every 5 year, every 10, I'm not for certain.
I don't know. I mean, I had one several years ago, and then they came out with a better one.
Yeah.
And they said once you get that one, you don't need another shot.
You're good to go. Yeah. Just the standard pneumococcal, I think it's either 5 or 10. Exactly. Yeah. Yeah, because, we are coming into cooler weather. What do we do in cooler weather? Well, we go indoors. We, are regular people. So that's where we pick up bugs at. And again, seasonal flu. Get that flu shot, because otherwise, if you get the seasonal flu, that puts you in greater risk for pneumonia. And pneumonia, hey, I have to tell you how deadly that can be. So serious stuff, very serious stuff.
The way it was explained to us at Memorial is a lot of people think that this affects the lungs like pneumonia, and it doesn't. It causes the lungs to swell.
Yeah. If you look at a CAT scan of someone with COVID, it has what we see, what's referred to as a ground glass appearance. Okay? Ground glass appearance. Which, from a diagnostic indicator, not a good thing to have in your lungs. Okay? It can cause the swelling. It can even cause a collapsed lung. Okay? Because of just the infection, the inflammation, the trauma that the lungs have received. And especially in folks with asthma, with emphysema, who already have some compromised, lungs. Yeah, I mean, it just makes it worse. Imagine getting the flu when you don't even have any of those conditions. I mean, you're coughing, you're feeling bad. Imagine putting COPD or emphysema, asthma in that picture, and then get COVID on top of that. Yes, you're sick.
So long-term implications, I know I've heard like a Western report the other day where people were saying they were having hair loss. The doctor come back and said that was more than likely because of stress, not from COVID. But then there's also people that have lung issues that are saying months down the road that they still have those issues.
I don't think we really know at this point what the long-term complications to COVID are. Does that mean everyone will get them? Not everybody, but a certain amount of people will. People may develop hair loss. They may develop a little bit of maybe some memory issue. Depends on probably the severity of their illness. They may have a prolonged respiratory inflammatory problem from COVID months out, years out, and it may ultimately kind of make like a COPD, which is chronic obstructive pulmonary disease. It's just, we don't always get it from smoking. We can get it from a lot of different things, but it may be a picture like that. So, anything else?
So that all the healthcare professionals are saying, get the flu shot, get the flu shot. Will we see a shortage of flu shots this year? Past years you hear there's a shortage of flu shots, because you would think that more people are going to go get the flu shot this year compared to last year.
All right, so that's a great question, okay? Because we have seen shortages. And a lot of times when we'll see shortages is when we really have a bad flu season and people really start getting those flu shots in December, January. You should have already had it by November, you know. So that's when we start seeing shortages. Vaxxer, Glaxo, a lot of those companies, what they'll do is they start taking orders in January or February from big companies, hospitals, doctor's offices, etc., of how much of this stuff to make, because they don't want to get stuck with it, right? So you have to pre-book this stuff. So think about it like this. If you had to pre-book this stuff by the end of March, well, COVID was already ramping up. So I'm confident people thought far enough down the road, ooh, we better order a bunch of this influenza A and B, which made Vaxxer and Glaxo and Merck and all these companies that make it wrap up their operations, and they're making millions of doses. So I think, you know, could there be a shortage? It could be, but I've got a feeling that they look far enough down the road and realize, hey, we better make a bunch of this stuff.
It'll come too with, like, if you have pets, be careful around them because it is transferable to your pet.
Yeah. We just don't know a whole lot about it. Even, I mean, think about it, how far we've came. We looked at the numbers where we were in March and look at them now. But look how far we've came. I mean, we can probably all remember when CDC said, well, you know, I'm not sure if wearing a mask is such a great idea or not. You know, we can all remember that. We can all remember, you know, well, yeah, COVID, it really affects more older people, but we've kind of found out, well, you know, it doesn't discriminate. It attacks, you know. We know it attacks older people more severely, but, you know, every day we learn a little bit about it. I learned a little bit more about it when I talked to Dr. Vosia the other day, and so it's a learning process, and it's just one of those things where as we go by, as time goes by, we'll learn a little bit more about it. Anything else? Guys, thank you for your time. Always great to meet with you, and I certainly enjoyed it. Thank you.